second postpartum checkup?
Well, it depends on every physician usually they come 4 to 6 weeks, and it's been shown now that you don't have to have a set standard as far as a set day for a postpartum visit and the vaginal delivery or the C-section. It's really when the patients feel comfortable, as long as they come into the office. There are certain things that you want to discuss at that time. Usually they discuss, see how things are going, but especially you want to find out whether there are any signs or symptoms of postpartum depression. So I think that if you have that between 4 to 6 weeks, you'll be able to catch that. And also then discuss possible method of birth control or other conditions that I think is important, and it's very important to have that postpartum visit. And
you mentioned birth control. Women are really fertile after they give birth, aren't they?
Well, women are fertile overall, I'm saying. But,
no, but they're really.
Well, you have to understand that it's difficult to know exactly when your ovulation is going to happen. Because remember that you just delivered and we don't know exactly when ovulation is going to happen. So a lot of times patients tend to be fertile without knowing exactly when they are. There's not a way that you could plan as this is in the 14, 15 days right after your cycle. So that's definitely a condition. But you have to understand that when you're breastfeeding, less likely you're going to be ovulating, so you're going to be less likely to be fertile after that. And then, of course, there's a huge question, when can I have intercourse right after delivery? And I think it's so important, depending what type of delivery you have had and whether or not you had an episiotomy or there were stitches or so on. There's not really a particular time in which you should or should not have intercourse, but I think it should be when you start feeling comfortable and you make sure that you didn't have a laceration or something that could somehow be damaged right after intercourse.
Couple quick questions. When is a woman cleared to do vigorous exercises after natural birth?
Well, I think in general what she described earlier, right after the third week, I think this will be ideal. I mean, and as far as vigorous exercises, it has to do with your level of training. Okay, if you weren't exercising ever before and you just gave birth, don't expect to do vigorous exercises right 3 weeks after you deliver.
Exactly.
I think that you have to get in shape in order to make sure that you are able to do those exercises.